Good morning. Day 20 post prostatectomy operation. Just a quick update on the situation. My name's Ian Taylor. I got diagnosed with prostate cancer 18 months ago. Active surveillance for around that time, and then a radical robotic prostatectomy on the 1st of December 2025. It's now the 21st of December. It's been a roller coaster of a ride emotionally, really, from being diagnosed. But I've been positive. Operation took place on the 1st of December, as I say. And 3 weeks later, well, just less than 3 weeks later, no pain relief. Small amounts of manageable incontinence with pads, and this gets better every day using the recommended Kegel exercises. Coming on to Kegel exercises, I thought I was doing them right. I got the NHS Squeezy app, which reminds you to do them, and it's got a timer on, and stores and records the sessions that you've done, so it's really good. I went onto the internet and found a very useful video from a physio who specialises in pelvic floor. I didn't realise there were that many pelvic floor muscles. In fact, I think there's 4. And you need to focus on the one that's at the front, that's going to, as they say, keep the pipe, stop the urine. There are other exercises that will do different things, so it's really important to make yourself aware of what you want to achieve, and so what exercise you need to do. And it's also important to do these upright, sitting up. I initially was doing them reclined in the chair, felt that it was better, but I was doing more of the back muscles than the front, which is what I needed to do. So sat upright or standing is the way to isolate this pelvic floor and get the right contraction to give the best results. So, as I say, no pain relief for over 2 weeks. A few problems with my bowels for the first couple of weeks, but nothing a bit of lactulose and senna didn't sort out, really. I've walked every day, and on this video, pelvic floor physio says walking is the best exercise. You can't really do too much as long as you listen to your body. So from day one, from the day of the operation, I was walking. It was uncomfortable, but I persevered and increased the distance slowly. I've walked 43 miles since my operation in three weeks, and I'm sure that's aided me recovery in relation to pain and continence and constipation. Prior to this op, prostatectomy was the last thing I wanted, really. The last thing. But my mindset's completely changed. It's the best thing I did. It's out, it's sorted. And if you look at younger men, before the age of 75, then obviously there's risks from radiation later on in your life with your bowel and your bladder. Whereas prostatectomy, there's not. It's not an ongoing treatment. You have one operation and it's sorted. Yes, you've got to deal with the discomfort after, but it's then sorted. It gets rid of those risks of radiation on your bowel and your bladder. And it's one treatment. And psychologically, it's out, it's gone. It's so mind-altering to think that it's gone. You never have any problems with enlarged prostate the rest of my life. It's pretty good, really. So, don't be frightened, although you will be. Be positive. This is a very effective surgery, minimally invasive with the robotic techniques they've got. I've done the right thing. I'd support and suggest anybody do this, if it's right for them, obviously. So onwards and upwards. Histology reports will be in the next couple of weeks. I'm back to work on the 5th of January. That's 5 weeks off work. Lifting, carrying, bending. I've done exactly what I've been told. But I've walked and it's been brilliant. Plan to run on the 1st of December. But it'll be walk run, and it'll be built up over a number of sessions till I get my fitness back, and I don't want to risk any sort of injury, setback, hernias, anything that can happen by straining too much. So that's my story so far. I feel well, feel positive, and apart from the incontinence, erectile dysfunction, obviously, things are good. So here comes 2026, happy days. Just to recap, this disease kills 12,000 men a year. That's 1 every 45 minutes. These could be saved, so early detection, early treatment and better outcomes. 55,100 new cases per year are now being diagnosed, and that's just going to rise exponentially with the event of people like Chris Hoy, Sir Cliff Richard, Dermot Murnahan, King Charles. So it's important, once you get to 50 being white, 45 being black, get yourself tested, request a PSA blood test. It's just a single blood test that can sort of, it's not the golden bullet, but that's the test firstly. And if you've got any problems, urinary incontinence, difficulty passing urine, but like most of the men, there aren't any symptoms. So you don't know till it's too late. So take responsibility, speak to your GP, practice nurse, discuss your issues, get tested, and catch this early. I'm a lucky one, you know. I caught mine by chance, being a nurse, and I knew there was something not quite right. And so I've dodged the bullet really, by going, speaking to my GP, getting tested, identifying it early and deciding on the treatment plan. I feel so lucky to have done that and not ended up with stage 4 prostate cancer. Anyway, I hope you all have a happy Christmas, happy New Year. It will be for me, and all the best.